welcome back to Talk 1260 KTRC, the Humanity Behind the Vanity. This is Dr. Daniel Ronel, a plastic surgeon. I'm here with my wife, Betsy.
You have to thank your sponsors this time.
Yes, thank you to Suniva Medical, the makers of Artifil, one of my favorite fillers. There's a lot of fillers out there, but Artifil is very special because it lasts so long.
Right.
And it's very versatile.
I love it. It's very natural.
And if you have any questions about anything we've talked about, you can email me. You can go to the website, which is danielronelmd.com. All right.
What's your phone number?
988-8886.
Call.
Yes.
All right.
All right.
What do you want to talk about now?
There's a new thing. I've been asked to do this by a bunch of patients over the years. Started to do it. It's actually Buccal Fat Pad Excision. What is the buccal fat? It's the little fat right underneath the cheeks that in some people makes them kind of look like chipmunks. And especially, I think in the early 80s, there was a real sort of fashion trend.
You don't know what you're talking about.
Out
because
cheeks.
I just muttered this to you briefly and you already got the decade wrong.
Okay,
I will tell you. Because once again, I know more than he does. Okay. In the
Which you should.
Yeah, I do. I'm sorry. I've lived. I haven't buried my head in a book my whole life. I'm so sorry. Okay. Irritating. All right. So in the early 90s, the trend, there was this one model who came out very freakish looking, but it was like kind of a freakish beauty. I forget her name. She was Donna Karen's model with her boyfriend at the time. God knows where they've gone off to since. Anyway, she had these super cheekbones, these massive lips, and absolutely no fat in her cheek. And she looked like we all would, but better, sucking our cheeks in, you're making a fish face. That kind of thing.
Right.
And
for those of you watching,
right, for you
YouTube.
watching, if you can even see it. Anyway, so she started a trend where all these models got this little fat pad taken out of their cheeks, and they're like 18 years old. And there was a warning done by plastic surgeons and facial surgeons who did them at the time, saying when you're older, you're probably going to want this back in there. But you know, what it did was it helped sculpt their face even further. Yeah. These are already exquisite, abnormally beautiful human beings. They just did this to make themselves a little more sculpted looking. Yeah,
and nowadays the trend is to just take out a very small amount, maybe even 1 or 2 grams of buccal fat, and it's really easy. It's just a stab incision just made right next to the second molar in the cheek, and you kind of press and squeeze, and you squeeze it out.
Gross.
And you know, you swell up for a while. I have a guy in Colorado who I did who's emailing me his pictures of his swollen cheek, but it goes down.
Yeah, I mean the cheek is very sensitive.
Right, and then you end up with this, you know, slight depression under the cheekbone, which in some people looks really good. There are some people who truly have a lot of buccal fat.
Oh, absolutely. You know, and
there are certainly candidates for that, and they get herniated buccal fat. There's a lot of papers and literature on buccal fat pad herniation, and so as is many things in plastic surgery, you take something that's extreme and abnormal, and then you can sort of modify it to apply to something that's normal, and it becomes an aesthetic trend.
You know what I do though? I always wanted that indentation too, but I don't want my fat pad taken out because one day I knew I was going to use it, and I remember these warnings. So he makes my cheeks larger, my cheekbones larger.
Oh yeah.
And my cheekbones and my jawbone, and I have that a mild indentation, which I've always wanted, but I still have my fat pad in there. So when I'm 70, I'll still look okay.
Yeah, it's an important little thing, that buccal fat pad. Yeah, it allows you to chew, and within it, not anybody can do this, because within the buccal fat pad, there's the parotid duct, which is the duct that goes from your salivary gland. Yeah. So if you want to be able to digest your food, you know, and moisten your food, you got to have that duct. Excuse me, and there are a lot of nerves in there, the motor nerves to the corners of the mouth. So if you tweak the buccal nerves, you could have a crooked smile.
Can that ever be repaired or not?
It's interesting. The buccal nerves have a lot of cross connectivity. So if you damage one of them, more than likely all the other ones will compensate. Of all the facial nerves there are, those are the ones that are the most redundant. But if you damage enough of them, then you can really get a problem, and then you have to do Botox or revisional surgery.
What kind of doctors should be doing this?
Anybody who knows, this is my favorite thing, 3-dimensional facial anatomy.
Which are what kind of
plastic surgeon, ear, nose, and throat, or maxillofacial surgeon, the oral maxillofacial surgeons.
3. That's it.
Yeah,
do not go to your gynecologist to have your buccal fat pad taken out, no matter what they say.
That, or a dermatologist.
Right. No offense to the dermatologist, but any good dermatologist is going to admit to you they don't know how to cut and sew. Right. Really, they don't. And
no, they can cut and sew. It's just that in that part, you have to understand all the 3 dimensions of the face in there. That's your face, for God's sakes. That's the center of your face. Got to treat it right.
They don't know how to do cosmetic closures unless they've learned. Many of them will say, I'm sending you to a plastic surgeon.
Right.
Okay, just to finish my point, because once again, I'm right, as always.
Okay.
Right? Happy wife, happy life. I happen to always be right. Okay,
yes,
anyway.
Yes. And the best retirement plan is 1 house, 1 wife. Someone told me that today, yes.
You better behave yourself. Okay. Otherwise you'll be not one of these people that follows you around all the time. They don't know.
All right, what else do you want to talk about?
That's it. So how many people come, what kinds of people are coming to you? Older, younger?
Younger people. For the buccal fat pads?
Women,
it's usually, well, both. Half and half. But everybody so far has been under 30.
Oh, really?
Yeah. Yeah.
Why are they doing it?
Because they think that they'll look better. They're not doing it for anybody else. It's something that has bothered them for most of their young adult life. They say
are these people
teenagers.
Who you would say you do have little fat cheeks?
Yeah.
They're not fat people. They just have those little fat, juicy cheeks.
They're not fat at all. They just have rosy, juicy cheeks.
So they think they look too young.
Mm-hmm.
Yeah.
Right. Yeah. I mean,
they don't like the shape of their face.
Right, it's that they don't like the shape of their face.
I get it.
And so that's what it is. It's sort of the similar crowd as the dimple creation crowd.
Oh,
the
really?
people who want the dimples, which is almost the same procedure, just taken a little bit closer to the skin, and you can create a dimple, and it's pretty much the same crowd.
Oh, really?
Yeah.
So you never get older people who say, I want the fat pads taken out?
I haven't yet. Usually it's the opposite. They want their fat pads put
back. Right.
And that's what the facelift does. It pulls up the
fat
pads and puts it back where it used to be.
Right.
Yeah.
Interesting.
Mm-hmm.
All right, good. So we got to wrap it up. So
okay, well, thanks very much. If you have any questions, please email me, danielronelmd.com. If you go to the website, you can hit contact us. It goes to me personally. Our phone number is 988-8886. We're going to have Marion Urban on the show soon, so she can talk about her skincare products and laser products.
I've been using that skincare Neocutis. My God. And I never am a big rave reviewer about skincare. I think they're all okay. This one, amazing. Really great.
Made from
It's
stem cells.
And it's not tested on animals, which I love.
Good.
So it's excellent, heavy duty stuff. Also, you can find the Big Doctor on Facebook.
Right.
He does a lot of stuff on Facebook.
Right.
He
a lot of promotions coming out.
He says good morning to you every day. I always got a wise answer for it, but I never type it in. Anyway,
All right.
So that's it. He's around. You can find him if you want.
Have a good rest of the day. We'll talk to you next week.